is March 24th. It's like 1 a.m. in the morning. I had breast reduction surgery yesterday, and it was the absolute worst pain I have ever experienced in my life. When I came to from the anesthesia, I broke down because the pain was so unbearable. It was terrible. I think the doctor said I was maybe in H cup. No, he said between either an F or a G cup, which is news to my ears. I didn't know that my breasts were that large. They normally ask you what cup size you would like to be, and because of my body size, I wanted to be at least a D cup. And I was told that, that's what we would be going for, but I don't know, maybe I'm just wrapped up so tight now that it doesn't really look like, a D cup. Looks like it could possibly be maybe a C. I don't know. It's been about 12, 13 hours, somewhere up in there. Exactly 14 hours. The pain is not so much. On a scale of 1 to 10, the way I feel now, about a 4 or a 5. If I'm sitting still, I don't feel anything, but if I get up, I can feel a little annoyance. It's not really an actual pain. I don't have to take the medicine. But when I came out of surgery, I think I took like 3 pills, not all at once. I took one in the hospital. I took one in the car on the way home because during the drive, it just felt like the pain was not going anywhere. And once I got home and I still felt the pain, I had to take another one. And I do not recommend that because I was super dizzy and I didn't like that feeling. So that was the last time that I had actually taken any medication. So, I feel okay right now. Don't know how I'll feel tomorrow. When I got home, I was still, a little groggy, sleepy, so I ended up dozing off. And when I had woken up, actually they give you these JP, I forget what they're called, to drain your blood. And the left side actually was draining way more than the right side. But when I dozed off when I got home, I actually slept on my right side. And, in the paperwork, it recommends to not sleep on your side. I didn't read the paperwork until I woke up because I actually asked the nurse that was caring for me after I came back from surgery. I asked her, was it okay if I slept on my side? And she said it shouldn't be a problem as long as I'm careful. So I took her advice. But when I woke up, my back was actually wet, where the blood had come out of the bulb was actually inserted on my side. So I've been milking the JP plug to try and get it to come back out, which as you can see, it started coming back out, but it's definitely not coming out as much as it was at first. And the right side, this side was always, it wasn't that much coming out of this side. And in this part, it's actually light pink already. So I'm hoping that's a good sign. I wanted to go to the emergency room tonight because I know that in the discharge papers, one reason it says to seek medical attention is if your dressings become wet. And I bled through my dressing, and I was told to not take the dressings off until 3 days. So I did want to go to the emergency room, but because I don't know if they know anything about this, I think that I'll just wait until tomorrow and go back to the actual doctor that performed the surgery. But yeah, I was having back pains. I had really large breasts, and I've had back pain since I was maybe a teenager in high school. But I always thought, because I was a little on the overweight side, that it just came from the weight that I had on me. Until I had a friend girl, she had the weight loss surgery because she had large breasts as well, and it caused her to have back pains. And when she told me about it, I spoke with my primary care doctor about it, and he recommended the breast reduction. This all took place last month. I spoke with my doctor about it. He ran x-rays on my back. He referred me to a breast reduction surgeon. I got in the office, did a consultation, and they scheduled me an appointment for, it was, I think, 2 weeks after visiting that doctor. And I got that surgery done yesterday, so everything happened pretty quickly. That pain is terrible, though. It's terrible. I was actually going through bariatrics to try and get gastric bypass surgery. And you start losing weight on your own, you start getting your confidence back. I wanted to get the breast reduction surgery along with the gastric bypass surgery. And I was told, it's best to get the gastric bypass surgery first and then the breast reduction. But I was just really being impatient. So I had the breast reduction surgery done first. And I don't know what's going to happen with the gastric bypass surgery. But I wanted to share this with you all about the breast reduction surgery. I cannot wait to get this over with. I want to see what they look like. They are extremely small already. I mean, I can definitely see a difference. They're small. I'm just ready to take off the bandages and actually see them. This is a special bra they give, I guess, to keep pressure on the breast, to help the swelling go down and the draining. So my follow-up visit is in 7 days, but I'll actually be able to take the dressing off in 3 days so that I can clean the area. So I'll show you all an update of that in 3 more days. And anyone that's having, back pains, you have, problems with your bras digging in your shoulders, neck pains, upper, lower, middle back pains because of your breast, it's very possible that, the type of insurance that you have can cover for you to get a breast reduction. Like I stated, I mentioned this to my doctor last month. I think it was the end of last month, and I've already had the surgery this month. So it wasn't even a full 30 days out that I mentioned it to my doctor. So I'll show you guys an update once the dressings come off.